So you're a PT or PTA grad who's feeling the spark of something more. Maybe you dream of building your own business, one that's constructed around your vision, one that empowers you to make a real difference on your terms. This feeling, it's the entrepreneurial itch, and you're not alone. Countless PTs and PTAs are taking the leap to entrepreneurship, crafting careers that are as unique as they are. Welcome to the Innovate and Rehabilitate, the Entrepreneurial PT podcast. In each episode, we'll dive deep into the world of PTpreneurship with inspiring physical therapists and physical therapist assistants just like you who are crushing it on their terms. We'll uncover their secrets, their struggles, and the incredible impact they're making. From building your PT boss dreams to navigating the business side of things, we'll equip you with the knowledge and inspiration to turn your vision into reality. So, whether you're just curious about starting your own business or you're already out there making your dreams a reality, this podcast is for you. Get ready to unleash your inner entrepreneur. Let's do this.
Hello, everyone, and welcome. I'm Derek Lee, your host for the Entrepreneurial PT. Today, I'm excited to welcome Jeremy Crow to the show. Jeremy is a nationally recognized leader in physical therapy with more than 20 years of experience in sports medicine and orthopedic care. He is the director of residency and fellowship programs at SPEAR, where he founded and continues to lead advanced training programs shaping the next generation of clinicians. Clinically, Jeremy is an expert in biomechanics and movement disorders with a recognition for his work in complex hip conditions. Over the years, he has treated a wide range of patients from everyday individuals to elite athletes, including serving as a medical volunteer PT at the 2016 Rio Olympic Games. As the founding director of SPEAR Sports and Orthopedic Residencies, Jeremy has played a pivotal role in developing advanced clinical training programs. His thought leadership includes contributions to Managing Pain, published by the Reader's Digest, as well as numerous articles on hip and sports rehabilitation. Beyond the clinic, Jeremy has spent nearly 2 decades as an adjunct professor at NYU and remains deeply involved in advancing the profession through leadership, education, and advocacy at both the state and national levels. He has been active in the APTA and APTA New York since 2006, serving in roles such as the NYPTA Secretary, Greater New York Treasurer, and on multiple committees and task forces. He currently serves as a site reviewer for the American Board of PT Residency and Fellowship Education, is a member of its Residency Candidacy Council, and was recently appointed to ABPTRFE Candidacy and Initial Accreditation panel. He also consults on residency and fellowship program development across the country. He has also been a site reviewer for the Commission Accreditation PT Education for over 10 years. Jeremy, welcome to the show, and thank you for being here.
Thank you for having me. I'm excited for this.
Totally. It's I got to say, all the abbreviations and initials, it's like it's pretty impressive, the number of things you've been involved in. So I'm really excited to talk to you about everything. So, you built this really incredible career across clinical care, education, leadership. But I'd love to go back for our listeners and just have you tell us a little bit about your journey. Like, what started you down the path of becoming a physical therapist?
Yeah. So, I grew up I'm a farm boy from Iowa, so a long ways from the New York City sidewalks. But when I was in high school, I first shadowed a physical therapy clinic in Cedar Rapids, Iowa. And I was interested in athletic training at first. And then, so when I went to college, I was an athletic trainer at Florida State. And so that's how I kind of got exposure to sports medicine. And then I was fortunate to have, I worked with the Florida State Seminoles and we won the national championship my year. And then we did an internship with the Tampa Bay Buccaneers. So I kind of worked on the field in all different realms. And then back when I graduated many years ago in 2000, the DPT programs are transitioning, or the PT programs are transitioning to DPT from masters. And so I decided I wanted to still help people and do rehab. And so then I decided to, I moved to New York and applied for a PT school.
Wow. You had to throw in the national championship nod, right, of the Seminoles.
Yeah.
So that's pretty amazing.
I know. Yeah. And I know we lost the next year to you, actually, to Oklahoma. So
yeah, my school won the next year. So, but we haven't, we haven't been as good since. So I guess that's amazing though. So starting out as an athletic trainer, how do you feel like that experience shaped where you are now as a PT?
I mean, I think like the emergency response, because when you're on the field, you have to be able to react and have to like do that kind of that triage, obviously in medical emergencies. And then, so I think that experience can be translated to everything, even the clinic, because, emergencies happen in the clinic. So I feel like that was like a foundation. And then going on to PT school, then I sat for my sports clinical specialist exam. And so I feel like it's just a well-rounded, experience from the training room to the clinic to on field, and be able to just treat that wide range of people and athletes.
Definitely. I mean, it's obviously really shaped your, career trajectory. It seems working with athletes early on and everything. But do you feel like there was a moment, maybe early on your time at Florida State as an athletic trainer, like where you changed directions? Like, was there a moment, or was it, what kind of drove you to change directions to become a PT?
Yeah, I feel like I had an amazing experience doing a summer internship with the Tampa Bay Buccaneers. But if you think about professional sports, and any sport, but especially professional sports, they're long hours, 7 days a week, 2 days. It was just a lot. And like talking to the head trainers and the other like graduate assistants, and like there's 100-hour weeks, and it's just like 10 weeks of the year. Because even when season's off, the athletes who are going to have surgery and are rehabbing, so there's really no downtime. And so I wanted to have more of I thought PT would be a better balance of life, if that's truly possible, but it would be more consistent.
That makes perfect sense. And that like that 24/7 lifestyle, working with the sports and working with the sports team is definitely a lot. So it sounds like you made the right choice. For the listeners, when I started out as a clinician, as a new grad, I worked in the same clinic as Jeremy, and that's why this next topic of his interest and really work with the hip is important to me specifically, because I feel like he gave me so much mentorship in the beginning of my career about this stuff. But I am curious for you to talk about, Jeremy, for our listeners. Like, you become really well known for your work with the hip. How do you feel like, how did that even happen? What led to that?
So realistically, I hated the hip when I was in PT school. It's kind of ironic, but yeah, I just didn't like it. I like the ankle, I like the knee, the shoulder, but my last affiliation was with my CI was a big hip person, and so um, being with him for 10 weeks, all we did was treat hips for, for 40 hours a week. And then during that time, I had the privilege of meeting Dr. Brian Kelly, who now is the president CEO of HSS, but he was a very famous hip surgeon. And so I made those connections back when I was a student, and I was fortunate enough to observe him in the OR and then in his hours. And then when HSS opened it was the Preservation Hip Center, and they were asking for PTs to come help him during his office hours. So I was fortunate enough to have spend time in his office during there were different days, but like one day a week for almost until like 2020, or 2020. So almost it was like 14 years. So I got to know him and like the process and like kind of like the other intercollaborative routine of just talking about the difference between like how that he sees as a surgeon to like the PT performance, because he knew how important PT was for his patients, and especially after surgery. So for about 10-15 years, we saw like all his patients, and we helped him write the protocols for it, the hip arthroscopies. We helped him do like proximal hamstring repairs. We did his glute medius repairs. So we just fortunate enough to have at the clinic that I worked at, he relied on us to help support his rehab components.
Definitely. I mean, what an amazing experience. I mean, to be able to work with, kind of like the, premier hip surgeon, kind of pioneer of the field, type of individual, it's got to be pretty amazing. How do you feel like that experience working with Dr. Kelly and just other surgeons at the Hip Preservation Center? How do you feel like that experience changed how you, approach clinical care now?
I mean, I think it was pivotal because I feel like during that time was obviously he had an important job and he moved up the ranks from, to like surgeon to kind of the chair of the hip preservation center to like he was the chief of sports medicine and then became like chief of surgery. So we followed him along the journey. And I think during that time, we also met a lot of different surgeons and fellows and residents and PTs. And, they have a huge international um, like visiting
Yeah,
service. And so we met just all kinds of people from PTs to surgeons, like I said, to residents and fellows. And I feel like having those conversations and teaching them as well, and just kind of being like leaned upon to help establish like best practice. I feel like that was the biggest thing and that kind of just carried on to other people because you came into, people get to know you from your work there and then just collaborations with them. And just, it opened up a lot of doors of just with everyone.
definitely, definitely. I mean, on this specifically in regards to the kind of clinical component of your career, do you have any advice even for a young clinician, fresh out of school, like, that's maybe interested in going down a similar route to you? Like, what advice would you give them from a clinician standpoint?
Just from a clinician standpoint, I mean, I feel, I don't know, I feel like I'm so unique, and as my patients and my coworkers will tell
That's
me,
true.
um, it'd be great to have a lot of those Jeremys running around. I'm not gonna lie, but I feel like it might be my coworkers might differ and have a different opinion on that.
There's only
But
one,
I feel
Jeremy.
like
There's only one.
but I feel like, the biggest thing about like anything is just being passionate about something. I feel like my journey was an incredible journey, and I was just fortunate enough to have mentors from clinical instructors to my first boss to, my coworkers now. I just feel like I've had a lot of mentors, and then I've been fortunate to have exposure to different things with associations and, APTA New York and APTA, and then all these other committees I'm involved in. I just had really good mentors. And I feel like, like how we can make the world better is by having just being a good human and giving back. And so I had great mentors. And so I feel it's my duty to give back to the newer generations and inspire them to be passionate about something and just kind of continue to pursue it. And that's why I feel like, the residency is a really good step for me now because I feel like it can inspire, obviously new students and then the residents.
Yeah, definitely, definitely. No, well put. I mean, going in line with that, kind of transitioning outside of the clinic, even, you wear a lot of hats right now. You're a clinician still treating a good amount of patients per week. Educator, leader. How did your transition into those roles happen? Can you describe that for us?
It was my first day of PT school. I still remember to this day, 2006 or 2003. Marilyn Moffat was was a professor, and she came in our first day, and she's like told everyone the importance of being an APTA member and being involved in the association and giving back through obviously all the different things. So from that moment on, I joined APTA. And then I just got involved as a student, and then when I graduated, got involved with the different associations at the state level. And it was like in 2010, there was the current secretary of, at the time, it was the New York Physical Therapy Association, ran for vice president, got elected vice president. So the executive committee had an opening for secretary. And so my name was one of the names that was um, being thrown around as potentially taking that 1 year gap. And so I interviewed for the position, and the EC appointed me to fill that 1 year seat. And so I served as the secretary in 2010 to 11, and then I ran for a secretary two more terms. So I served for 5 years, and I feel like I was very young then and naive, and I feel like I could do anything, and oblivious to the world really. But I feel like it was a very eye-opening experience because I never served on a board before, let alone the executive committee. And it was a lot of pressure to like obviously perform, but also to do well. And I still joke with one of my great friends, Matt. We're sitting in the first board room. He was just elected president. I'm sitting next to him, and it's just like this. It's October, the budget meeting, and people are like nitpicking like copies, 5 cents for this and this. And I looked at him. I'm like, what do we do? And he's like, I have no idea. And we just like still to this day laugh about like, we both sat there, like we're sitting at the head of the table of this big board and like, we kind of really didn't know what we're doing, but we figured it out.
That's
And,
amazing.
we were very successful. And it's like one of those things, like those type of moments, I feel helps. I know I always like to, obviously most people like to win and be successful, but I feel like the moments when you are pushed outside your comfort zones is when you really truly grow. And as much as you might hate it in the moment, I can still remember that as part of a pivotal moment in my journey of leadership.
Definitely, definitely. I mean, that's amazing to hear, because I think a lot of people look at leadership, advocacy, hearing things maybe that you've been involved in your career, maybe you're like kind of nervous about it, like they don't feel like they can do it. It seems like such a big role, big responsibility. I'll never be able to do that. And to hear someone like yourself who's accomplished so much in the field be like, yeah, I had that moment where we didn't know what to do, and we just figured it out. That's really amazing and inspiring. On the advocacy side of things, were there any moments in your time and current time even, with the APTA, the NYPTA, where you really saw the impact you can make?
Yeah, I mean, I think there's a lot, but the one that really comes to my mind is, when I graduated in 2006 in New York State. It was when we got direct access. So I remember going to Capitol Hill for not Capitol Hill, for Albany for it was equivalent to like our Capitol Hill Day for APTA, but we went up to Albany, talked to our local representatives and senators, and we're advocating for direct access. And then I think it was August maybe of 2006 is when New York State passed it, and so the direct access of 10 visits or 30 you can see patients for 10 visits or 30 calendar days. That
Yeah,
was when it first passed. So I feel like that was like, they had been
it's
working on
huge.
it for like 20 some years. And so I think that was a big moment for us. And
Yeah,
I think now every decade, every year, there's new issues that we're trying to advocate for.
definitely, definitely. I mean, that's an amazing example, because that was huge. That was like, groundbreaking for the field of PT, and to be
Yeah.
involved in that process and see it happen has got to be pretty amazing. Um, for anyone that's listening too, just on the advocacy side of things, is where's a good place to start if you're a young clinician interested in advocacy? Where do you think is a good place to start?
I mean, the easiest and the least committal time is to be able to join APTA and join your component. So New York State chapter. I think that's the easiest way. You just give some money to your association, support your association, and support your local chapter. Because again, we're as a profession, I forget how many hundreds of thousands of therapists we have, but we only have like 100,000 members. And if you want to do anything legislatively, especially when we're fighting against, the athletic trainers, the doctors, the chiropractors, they have a much
Chiropractors, yeah.
stronger um, advocacy because they have more members and more money to advocate certain things. So I think
Definitely.
that's the easiest thing. And then the next low level type of thing is just attending a meeting. Like we had APTA New York, Greater New York District is where we're in from Manhattan. We had our local meeting last night, and so just attending a meeting is the next step of getting your name out there and just getting involved and trying to figure out what the association is. And I've always been people always complain about things, but it's one thing to complain, but if you don't do anything and don't have to take any action, then it shouldn't really, it doesn't really count. And so I feel like if you're going to
Yeah,
say something, you need to do something to be active.
I love that. It's phenomenal advice. So yeah, people listening, uh, make sure you're a member of the APTA. Show up to your local meetings. Don't complain unless you're going to do something about it. That's well put, Jeremy. Um, in how has the leadership roles you've been in with the APTA? How do you feel like that's changed the way you think about the entirety of the profession? Or have what's your take after being so involved in the profession? You know, how do you view it now?
I mean, I think people get frustrated because again, it's like anything in corporations or any type of thing, it takes time, and it's like we want quick fixes and we want changed tomorrow. But unfortunately, there's a way, a process of doing things, and I feel like learning the process and understanding that it's not just what you think to get through it. You have to look through multiple different lenses, and so I feel like that was the biggest thing because I feel like I was frustrated at the beginning. It was like, oh, we should be able to do this, this, and this. And then you realize there's a process to do it, and it takes time, and it takes, diligence and patience to really pass anything, let alone
Definitely.
something when you're dealing with like legislation.
For sure. For sure. Um, well, that's, again, it's amazing. I think it's, thank you for even trying to, inspire others to do similar things you've done. That's how the profession is going to move forward, and that's amazing that you're doing that. Going back to the, education side of things, kind of talking about all the hats you wear, like educator and, kind of founding leader of the residency program at Spear. What inspires you to take on that, task of building out a residency program?
Yeah, so I've always wanted to, like, when I came to Spear, I founded the clinical education part. So we started the workshops, we started our mentoring process. So I've always been involved with like wanting to, standardize things. And so I feel like the residency was something I've always wanted to do since I've come to Spear. And it just took, again, it takes time to do things and making sure it's the right fit at the right time. And it just took, a few extra years, but we got to it. And I think it's just one of those things, process of having, getting people to buy into it, understanding the benefits, but also, any types of risks or negatives for it and having to work those out as well. So it just being at the right time.
Yeah. Yeah. What were some of the biggest challenges that you faced when you're, kind of getting these? I mean, because you have sports and ortho, you've done both. So it's two different programs. What are some of the biggest challenges? I'm sure there's been many.
Yeah, I mean, so we started like non-accredited versions of them both in order to kind of get all the documents. Because if anyone who knows that has done a residency or even in PT school, there's lots of documents that you have to standardize because, again, you're trying to do standardization across the different with its residency or schools. And so the biggest thing for us for ortho was, just really getting enough mentors, getting enough OCSs to do the mentoring. And that's why we were able to do that one, because that was a little bit less time commitment. Because if you do a sports residency, accredited programs, you need to do 200 on-field hours. And so the 200 on the field hours is a lot of extra work. And then having contracts with like teams, we live in New York City. It's not like we're in the middle of, someone that has a lot of a high population of like high schools and colleges. And so having to find enough where we could have our residents cover the 200 hours, that was the biggest, like one of the biggest hurdles for sports, because we had some coverages, but it wasn't enough to get. So 200 hours is about 4 hours a week, which is a lot. And so, that took us a while. And then again, finding the mentors, like there was myself, there was Sarah, and then Joe, but there's only three of us. And so until we could find enough mentors to do it, those were kind of like the things that made us, delay the most.
That makes perfect sense. Those sound like, I mean, challenges in general, but probably even unique to New York, like you're mentioning. Like there's not a lot of space to perform sporting activities in New York. So, at least, I could imagine even that geographically being tough, when you're mentoring younger clinicians, say in the residency programs, what are you trying to instill in them?
Oh, that's a good question. I mean,
It's a $1 million question, right?
I mean, I think it starts is to start simply just being a good human. I feel like, we get in this field because we want to help people. And so just kind of taking a step back and just understanding, what does that help mean? And understanding, we're a kind of a customer service business, like providing the care, like what you're going to do for what this person is not going to be the same for this person. So, just understanding like where the person's coming from, and kind of like tailoring your treatments around that person. Because I can tell you, we're in New York City, people are very type A personalities. You're not going to change them. So being able to adapt and be adaptable with that, because I feel like that was my hardest thing, because I'm also a little particular, we'll call it, as my friends say. Um, but, and it's like, that's not going to change. But having to deal with someone who's also particular, you can kind of relate to them, but also understanding if they have to do it in a certain order, that's the order they're going to do it. And if you're not going to change certain things. So just understanding their kind of, their little, I don't know, patterns, and understanding that, and still be able to anticipate those patterns prior to them because knowing that they're not going to change. And so
Yeah.
that's part of it, is just trying to kind of tailor the treatments around their needs.
Definitely. So yeah, I mean, I like the simplicity of be a good human. I think that, that's something that, I said it's simple, but it resonates. It's so important as a clinician. I feel like to have that kind of mentality of just like, how could I just be the best version of myself as what would I want if I was in that situation as a patient? It sounds like that, as well as, being flexible, being able to kind of
Engaged.
engaged. Those are all things that you are trying to instill into clinicians that are going through this program.
Yeah, because I feel like just the engagement is the second piece of it, and it's and I feel like in our society now we're so kind of remote and like more phone and not really that taking that moment to like enjoy the conversation of another human. So I feel like when you do have those conversations, making sure they feel like you're listening to them and being open and engaged I think goes a long ways as well.
Yeah, definitely. Well, I mean, this is kind of, maybe this has a lot of overlap, but I'm curious to hear from you. What do you think separates a good PT from a great PT?
I mean, I think I kind of mentioned it before. I
Yeah.
feel like PT is more of a customer service business, and I feel like anticipating your patient's needs before they can articulate them is a big part of it. And I feel like I always tell my patients, it's like I want to provide the four seasons experience. So I want to have like you get the full experience in whatever that is. If that means like getting them, water after they do a certain exercise. If that means, when they're doing ice, that there's, you anticipate they always like to sit up, and just knowing kind of like their routine or knowing their tendencies goes a long ways. And also, like I said, you're just trying to make them feel that you heard them, and also because they're also most of the time are in pain or they're like going through something. And so having that understanding of like, just listening goes a long ways when you're trying to deal with people, especially when they're like, upset or in pain, and they could come off as, emotional, or they could come off and, just being, and it's nothing personal, because just having a bad day. We have bad days all the time, and be able to like kind of know when to like pull back a little bit, know when to kind of lean in, I think goes a long ways into providing that, the best service.
Definitely. So it sounds like that extra step of rapport building, anticipating needs, and really just trying to provide that excellent service to the patient. That seems to be the difference maker.
Yeah,
That's well
because that's
put.
what
Well put. We'll go on. Yeah.
you think about. If you go to a restaurant, or if you go to a hotel or whatever, some airline, I mean, there's or lounge, whatever it is, there's always like you have a moment where you're gonna feel like, how are you welcome, how are you greeted, and then at the end, how did you leave? Did you feel like you got something, whatever the service was? Did you feel like you had a content? You were content, and if you are, you're gonna come back, and you're going to anticipate or expect the same type of service. So I feel like, always making sure someone leaves in a better mood or better space than when they entered is always important.
I love that. So, we talked about you wearing, a lot of different hats, different roles, both at Spear, but also with, the various other roles that I mentioned in the beginning that have long titles. What does a day, or maybe a week is a better way to word it for your schedule, but what does a day/week in the life of Jeremy Crow look like? Like, walk us through that.
Well, I mean, I think it's so variable. I mean, it's the only thing that's consistent is my patient care. Like I always treat from 6:30 to 10:30. That's usually consistent. And in the afternoons, it depends. Like right now, we're going through, we're just selecting our residents. So we're going to be telling our residents who got selected, and then unfortunately the people who did not. So those are, anticipating that, speaking to the directors. That's kind of where I am right now when it comes to like clinic stuff. And then, I do a lot of stuff at night. Like we had, I told you we had an APTA New York meeting last night. Tonight, there's a payment policy meeting for APTA New York. last week I had a site visit, so have 2 reports I need to finish up for the site visits, and so each week's a little bit different. It just my April, May is always usually just busier with like either site visits, obviously residency stuff, and then just and trying to enjoy the spring.
Yeah, that's the weather's been beautiful this week. Yeah, that's amazing, and I think the grind does never stop. It sounds like, Jeremy. It sounds like you're
Right.
you're consistently putting in time with your roles, but to also make the profession better and advance the profession and advance yourself as a clinician and a leader. I mean, I think you spoke to it earlier. Your passion is probably the underlying, your ability to do that comes from your passion, I would assume, right? Like, is that what you feel like?
Definitely. And I feel like, it's fine to be content, but never be satisfied. Like I've always had this desire when I was a boy to be the best. And so I'm trying to tone that down a little bit, but try to be successful, but also try to, just continue to put myself out there into different positions. Like I'm doing my fellowship in higher education leadership right now, which is another, I've always wanted to do a fellowship. And so it's a lot of work, but again, being organized and, it's moments when you put yourself out there, and I don't necessarily do that very often. So it's important to do that so you can continue to grow and become a better person.
Definitely, definitely. That's really amazing. Looking ahead, where do you see PT education and training going in the next few years? Like, do you see it changing? Do you see it staying the same? What do you think?
I mean, I think it's definitely going to change, for unfortunately, and not necessarily in a good way, because of there's like some, I don't know if you're familiar with the legislation that passed about the capping the federal loans. So I feel like we've already had some of our techs in clinic talking about, you can maximize $100,000 for your federal loans. And
Yeah,
so that's going to put some people at a disadvantage for going to PT school, because the cost of PT school has continued to increase. And I feel like that's a real problem with, access, and um, just it's going to limit some people because they're not going to be able to afford all the private loans to go to PT school. And as a
yeah,
profession, we're already suffering with the least amount of PTs that we're having. So I feel like that's just
yeah,
going to hurt the number of people going into the school, or delaying and maybe choosing another profession, even though there's only one profession of PT. Yeah, I feel like that's going
yeah,
to
yeah.
really affect the turnover,
Change
or
things.
affect the yeah.
Yeah, definitely, definitely. I mean, it's just time will tell a little bit with, I think, some of that stuff too. If you had it your way, how would it change for the better? I mean, you've done a lot to make that profession better, and I could probably take a guess at what, based on our conversation, what you think would be helpful for clinicians. But how do you feel like PT education and training gets better,
I mean, I
improves?
think they're trying to, like, being involved with CAPTE and ABPTRFE. They're trying new hybrid programs, and they're trying hybrid programs for
Yeah,
PT programs. And I think there's like 3 now. They're like a DPT residency hybrid, and so it's like a combined 3-year program of doing, like, I think it's 2 years of PT school, and then the last year it counts towards, like, your clinicals count towards your residency hours for the right person. So I feel like they're trying
yeah,
to be innovative about different pathways to help
yeah,
combat the rising costs of tuitions. But yeah, I feel like that's one way they're
yeah.
targeting. I mean, I don't know how I feel about. I think for the right person, it's great, but I feel like for the average person, it has to be for the select individuals.
Definitely, definitely. I know there was talks at one point too, and just um, curious what you think, or all you in your experience, what you've seen, where almost like a med school residency is expected, kind of thing. Do you feel like that's something we're still thinking about, or is there schools that have tried it, or
Yeah, I feel like that has been like kind of the recent, like, I know there's the number of residency programs have like tripled in the last couple years,
yeah,
because of just the need. And I know back, 10 years ago, 15 years ago, they really trying to like mandate everyone going to a residency program. But at the time, there was just not enough residency programs, and there's still not a lot of like specifically sports residencies
Yeah.
that happen. So I feel like some of the schools are pushing their students to do that because I feel like the caliber of students entering PT school has also been a little bit lower. So I
Yeah.
feel like they're trying to use that to help bring the quality of the clinicians to another level.
That makes sense. That makes sense. Well, Jeremy, lastly, I feel like you touched on this briefly in our chat, which has been great, but if you could summarize for us, but if someone is in a similar position, I mean, a lot of listeners are maybe potentially either freshly coming out of school, potentially still in school, and maybe they're inspired by a path like yours, right? Blending clinical work, leadership, advocacy, dipping their toes in really all facets of our wonderful profession. What advice would you give them if they're just starting out?
I mean, I think it comes down to like starting off simply, being a good human, and just
Yeah.
being nicer to your neighbor, and then finding something you're passionate about. I feel like if you're not passionate about something, you're just kind of going through the motions, you'll never truly enjoy it. So finding whatever that, and our field and profession is so diverse. There's so many different ways you can do it, and I'm fortunate enough to wear many hats, and I love all the different hats I wear because it allows me to be different sides of my brain and personality.
Yeah.
But so I feel like being passionate about it, and then also just starting being an active member of the association. So joining the APTA, joining the component or state you're in, and then lastly is finding, if you have a clinical instructor or a mentor in your job in school, really take their advice from them, learn from them, I always tell our residents, you have so many different mentors and people in your life. Try to absorb as much as you can from everyone because everyone has a little different journey, a little different perspective. And the moment you get content with your journey, your professional, then you should definitely change correct professions because I feel like you should always be curious. And I can tell you,
Yeah.
I've been practicing for a long time, and I learned something from everyone I encounter with. Some obviously more than others, but I will learn something from everyone, and being open to learning. So I feel like that's kind of the key. Just never stop
Yeah.
learning.
I love it. I love it. Great advice. Great ending point as well. For listeners out there, take Jeremy's advice. It's great advice from someone who's been doing it a while and has done a lot of different things, which is really, really amazing. So Jeremy, thank you so much for sharing your journey and insight today. It's been great hearing about your path in PT, your work in advocacy, education, and leadership. So thank you.
Thank you for having me. It's been a pleasure.
Of course. And to everyone listening, thank you for joining us for this conversation with Jeremy. Please join us when we're back next month with another episode of the Entrepreneurial PT. See you later.
And there you have it, another dose of PT-preneurial inspiration to fuel your journey. Check out more inspiring stories from PTs and PTAs out there making waves by listening and subscribing to our podcasts on your favorite streaming platforms. And don't forget to rate and review this podcast. Thanks for listening.